Good morning. I'm Erin Parish, the worship associate this morning. My pronouns are she, they. I'm a short, white, cisgender female in my late 60s with short brown hair, and I'm wearing olive green pants with a black t-shirt with the white letters with the saying, "Imagine being scared of diversity, but not of dictatorship." Welcome to our sibling church in Valdosta, and also others watching from Nature Coast, Palatka, and elsewhere. You are welcome here. There is a high-pitched buzzing sound in our audio that you can hear on YouTube, so we're trying to fix it, so just bear with us. Ain't technology wonderful? This sanctuary is built on the ancestral lands of the Timucua and Seminole peoples. We walk humbly on the land to honor them. A warm welcome to any visitors who are here today. We're so glad that you took time to spend your time with us. Please feel free to join us after service in the social hall. Stop by the welcome table with the green cloth in the social hall, which is back there, and to join us for refreshments. And we'd love to tell you more about our Unitarian Universalism in our congregation. There's people at that table on the welcome team that would be happy to talk to you. Remy is going to light our chalice today. Remy, come on up. Tomorrow's Memorial Day, so this chalice lighting is for Memorial Day. It's by Charles Flagg. You can go ahead and start. In honor of those we have known and loved in the past, in recognition of the gifts and sacrifices they have made on our behalf, and in our sincere hopes that we may be worthy of their memory, we light this chalice. We give our thanks. Thanks, Remy. Our opening words are by Monica Jacobson Tennyson. Welcome. Bring what you bring, who you are, enriches us all. We say welcome to your joy, your hope, your pride. We say welcome to your grief, your fear, your anger, and the parts of you that are not yet ready to be seen and heard. Welcome to them as well. For we are people of faith, faith in our expansive welcome, faith in our ability to grow, faith in the precious gift of our truths, faith in the promise of trying, learning, changing, faith in our capacity to know ourselves and each other ever deeply. Welcome to you who are human. Welcome to you who love and are loved. Welcome to you who are blessed, which is all of you. Come, let us worship together. Please rise in body or spirit to sing hymn 1014 in the Teal hymnal. The title is Standing on the Side of Love, but the words have been updated to Answering the Call of Love. Each week, we invite you to write what is on your heart in this book that's by the doors of the sanctuary. Ours is a sharing community where our joys are amplified, a caring community where sorrows are lessened. Our first joy is usually our visitors, but we have no first-time visitors today. But we do have some joys and sorrows that are written in the book. David Wilcombe writes, "Last Sunday afternoon, Art Crummer, a former band member, asked me to play my percussion at his monthly gospel music sing-alongs. This was held across town at the United Church of Gainesville, whose members I consider our liberal religious cousins. Afterward, I got to visit with some people I hadn't seen in a long time." Cam Pierce, our administrator, writes, "Edge's Air Conditioning Company has maintained our fellowship's air handling units for over 20 years. Lori Edge asked that we hold her husband Dale in our thoughts and prayers as the doctors and medical staff at Shands work to save his life." Destin Rushing writes, "I just wanted to express appreciation to the volunteers who cleaned up the social hall this morning due to a leakage. And in case you haven't been in there, we did have a roof leak. I don't know how bad it is, but we'll see." And then Anonymous writes, "Lifting up a friend who needs some positive energy, thanks." Actually, it looks like it's M wrote that. We all carry joys and concerns, some we may not speak out loud, but hold them in our hearts. For these unspoken joys and concerns, I would like to invite you to come forward during this time of meditation and reflection and drop a stone in our communal water bowl. If you don't feel comfortable coming up, you can have someone else drop a stone for you. Let the water represent love and support of this church community for all who are gathered. Someone from our care team will drop 2 stones at the end for joys and concerns for those joining us online.
Morning. My name is James Chase, and I am the Director of Lifespan Faith Development here at the Unitarian Universalist Fellowship of Gainesville. I'm a white, medium-sized person. I'm 34 years old, and I have shortish but getting longer curly hair. I'm wearing glasses, and today I'm wearing black shirt, black pants, and a very lovely shawl-type shrug kind of thing with roses on it. I use they, them pronouns, and I am non-binary. And I'd like to invite our kids to come forward, and there's stuff going on right here, so we're gonna have to kind of scoot over here, and I don't know how well, it looks like the camera can actually see us very well. We're gonna come meet a friend of mine. You may sit on the steps, you may sit on a chair, you can sit on the ground, sit wherever you like, but we're gonna talk to a friend of mine this morning. This is my friend, Garglebert. This is Garglebert, and just to do a visual description for Garglebert, Garglebert has lovely cheetah print skin and face with a pink big nose and lots of blue, wild, zany hair, and is wearing a lovely pink dress and has yellow arms. Hi. Hi. It's nice to meet you all, but I'm also feeling a little bit shy. Did you know that where I came from, nobody wanted to call me by Garglebert? The family I came from, they called me Sharon. And Sharon is not my name. I don't feel like a Sharon. Do you think I look like a Sharon? I think Garglebert fits me pretty well, actually. But where I came from, people said that whatever name you were born with, that's who you had to be forever and ever and ever. Do you think that's true? It was really, really scary being where I came from. Because where I came from, they got really mad if I tried to get people to call me Garglebert. Sometimes people would tell me, no, Sharon, you have to be Sharon. You can never be Garglebert. Have you ever been told that you have to be different from how you actually feel? Have you ever been so angry? Have you been so mad? And then somebody tells you, you shouldn't be mad. Yeah, you try not to be mad. Yeah. How did it feel when somebody told you to be different from who you were? Kind of sad. Did it make you feel lonely? Yeah, that's how I felt all the time. But then one day, I found a big building. And there were signs on the wall. And the sign said, everybody come as you are. I was so excited. I was also really scared, though, because what if it was a trick? You didn't see the signs? They're out in the hallway. It was actually this building. And there were rainbow signs outside. And when I first started coming, there was the biggest boss of all, the minister here, was actually also somebody who had changed their name. What the? That's pretty cool, right? And this place made me feel so safe, and I was so happy to be here. Do you think that more places in the world should be kind of like this one? When I first came here, I thought so too. And I thought, wow, the people here in this building, they should go change the rest of the world and make the rest of the world be exactly like it is inside this building. There are a lot of people here. They should just make the whole world be like them. Should we make the whole world be exactly like us? Why not? Oh. So everybody else outside of this building is their self?
And no one is listening.
But and nobody will listen? That's probably true too. So can we make everybody in this whole world be better people right now, right now, right now? No. What can we do? You can't even travel all the way around the world in one day? That doesn't seem very fair. Urgh. But can we do things here in this building? Can we make people feel safe here, right here? If they happen to walk through those doors, can we help do work to make this place feel better? What could we do for somebody if they walked in and they said, hello, my name is Thumbelina Garglebert III? Should we say, no, you have to be called something else, that's a ridiculous name? What should we say? You could say, what if you don't like that name? What if you think that's a silly name? Should you tell them that? Say, I think your name and what you want to be called is kind of silly. No. Why not? Because they'll hurt their feelings. Oh. You think that if you tell somebody, you want to be called something that doesn't make any sense to me, that might hurt their feelings? No. Yeah, that might hurt my feelings too. Because I like Garglebert. And even if other people here don't like the name Garglebert, I don't want to hear about it from them. Okay, well, it was really nice to meet you kids, and I think I'm about done here. Would James like to say anything else? Thank you so much, Garglebert, for coming and sharing and doing our Moment for All Ages for us. That was incredibly, incredibly kind. And one thing that is true that I like to talk about, because I am the Director of Faith Formation here at the Unitarian Universalist Fellowship of Gainesville, is that we have values here. That every person inside this building is different and has different thoughts and opinions, but every person here has agreed to live by certain values. And those values include justice and equity and transformation and plurality and interconnectedness and generosity, which are all really big words, but they're things that we have agreed are important in this world. Those sound important. You're right. And the most important thing of all is that we agree that everything should come from love at the center. Love is all about finding and working and trying to do the work, and sometimes it's not fun or easy, but doing the work of building a world inside this place and then also outside in the bigger world where thriving conditions are possible for everybody, where everybody can get what they need even when the things that they need are different or in conflict with other people. And that's hard, hard work. So one thing I really like about this place is that people came here to do some hard work and to rest and also have fun. And that's it for the Moment for All Ages today. Thank you, Garglebert, for coming and hanging out with us. You're welcome. And we're going to sing our kids out, and they're going to go have a wonderful time in the play yard. Nursery.
Okay, before we do the invitation to generosity, Cam has figured out what the leak is in the social hall. It's from the fire suppression system, so it's not the roof, which is good. So they're coming over to look at it, so there might be some people in the social hall during social hour. So, all right, so the offering we take now is not a transaction, it's a practice of presence, a way of saying that what we do together matters, that this community matters. May we give as we are able, with gratitude for what sustains us, and with faith in what we can build together. The offering will now be joyfully given and gratefully received.
Good morning, everyone. I am sorry that I can't be here with you in person this morning. I have an out-of-state obligation. My name is Jean Cook. I am a medical doctor. I have been a member of this congregation for 41 years and an OBGYN in Gainesville for 43 years. In 2017, I began providing reproductive justice work for Planned Parenthood of Florida. And in 2024, I went through additional training to learn how to care for patients who require gender-affirming care. That was pursuant to State SB 254, State Bill 254, which was passed in January of 2024 and directly targeted trans children and adults. From that time on, adults who want to continue gender-affirming care must sign a detailed 9-page informed consent that requires approximately 40 initials and printing and signing of their name. And the state actually specifies that it has to be their legal name, not necessarily their preferred name. They have to do this in my presence once a year, and they have to sign an online in-office signature every 6 months. This care is now required to be provided solely by doctors, so either MDs or DOs. Prior to this bill being passed, approximately 80% of all gender-affirming care was performed by compassionate nurse practitioners and PAs around the country and in our state. However, they can no longer provide this care, and that has proved to be quite a burden on medical services in general, especially in states like Florida. If a PA or a nurse practitioner does provide gender-affirming care, they can be threatened with criminal and civil liability. Let's just to tone things down a little bit, because State Bill 254 is pretty scary. There are certain things that it does not allow the state to do. It does not allow the state to remove children from affirming homes or to investigate affirming parents. It does not force transgender children off their hormone if they were receiving treatment at the time that the bill was passed. The law does require that the first time a new medication is prescribed, it must be in person and include, once again, a new version of the informed consent. So practically what that means is that when I change a medication, the patient must see me in person and we must sign this foolish consent once again. I should tell you that the, quote, informed consent is a document that lists multiple pages of adverse side effects that it wants to warn the patient about. However, these are all the desired side effects that trans patients are looking for. So it is both hurtful and insulting to this population. SB 254 cannot prevent private health insurance from covering treatment for gender dysphoria. Well, what are we doing about it? We have a powerhouse of an attorney here in Gainesville. Her name is Simone Chris, C-H-R-I-S-S, and she is both a friend and a colleague of mine. She is the director of the Transgender Rights Initiative, which is a subset of Florida Legal Counsel, Southern Legal Counsel, which is a nonprofit law firm that goes after all sorts of injustices here in Florida. I should note parenthetically that the Transgender Rights Initiative is not allowed to receive funds the same way their parent organization is, so that later after the service we can probably discuss ways that as a congregation we may want to start contributing to the Transgender Rights Initiative. Simone is a powerhouse, and she has not one but 4 suits challenging SB 254. One such challenge is to restore physicians' ability to write prescriptions for necessary gender-affirming care to minors. Another challenge is to get ACA, which is the Agency for Healthcare Administration's discriminatory ban preventing Florida's Medicaid program from covering treatments for gender dysphoria. Another challenge is against the Don't Say Gay law that prohibits transgender teachers from using their affirmed pronouns. And then lastly, we are challenging, I say we because she's a close friend, we are challenging the state of Florida's blanket exclusion of gender-affirming care for all health insurance policies offered to state of Florida employees. A new bill is being considered that will impact the therapists working with gender-affirming patients, and it will punish anyone who aids and abets people receiving gender-affirming counseling under the age of 18. So what does gender-affirming care actually look like in Florida right now? Well, the 2 most important things to know is that it's out of reach financially and geographically for many, many, many patients in Florida. At 5 p.m. on July 4th of 2025, President Donald Trump signed what we refer to as the Big Bad Bill, and Planned Parenthood was a direct target of that bill. In signing this bill, the federal government began denying any patient in the state of Florida to visit any Planned Parenthood, and actually I should have corrected that, in the country, excuse me, any Planned Parenthood in the country, to be seen for any diagnosis if they had any Medicaid plan or a Medicaid replacement policy. And they were not even allowed, they are no longer allowed to use private funds to pay for appointments. So even if they're not using their Medicaid, they cannot be seen at a Planned Parenthood. This has had devastating effect, and if you think about the fact that Planned Parenthood is by far and away the largest organization that provides sex education in this country. It provides counseling of all sorts. It provides contraception. It provides prevention against HIV disease. All of that is cut off to that population through what is often the only organization in a town or city that is providing these services. I actually observed the personal effects of it because July 4th was a Friday, and at 5 p.m., the president signed this bill. My clinic in Gainesville for gender-affirming care is an all-day Monday clinic. So we walked in Monday morning having Medicaid patients on our schedules who we could not even let past the waiting room. I wound up blowing kisses to patients across the glass in our waiting room and writing for the longest prescriptions I could. A child from Pensacola had just turned 18, and his very concerned parent had driven him from Pensacola to Gainesville to see me for the first time and initiate gender-affirming care. They had Medicaid, and that was unknown until they arrived at the clinic. They were both sobbing as I desperately searched and found a local Gainesville physician who would see this patient because he did not take Medicaid. So these are the sort of real-life challenges that our patients are experiencing. I was up in Tallahassee this last week, and one day I saw a patient from Cocoa Beach. The next day I saw a patient from West Palm Beach in Tallahassee, Florida. Patients are desperately driving all over the state with the increasing cost of gasoline. Our typical patients are those who could not afford to flee Florida in 2024. These are people with either strong family ties or more often an economic inability to relocate elsewhere. They typically have entry-level jobs. They may have very little or no family support. Many of them only have friend support through online chat groups. And they are desperately trying to initiate and continue their care. If all this background wasn't enough, I had a crushing conversation with the Chief Financial Officer of Planned Parenthood of Florida this last Monday. After 60 years of continuous service in a little brick house at 914 Northwest 13th Street, Planned Parenthood of Gainesville will close next month permanently. Lest you forget that we often pass the plate for Planned Parenthood of Gainesville, and I have felt so proud of this congregation and proud of Planned Parenthood for the networking that contribution represented. So this is hitting very, very close to home. One of the things that is heavy on my heart right now is that we have nowhere to see these patients after June 26th. Planned Parenthood has not been able to locate a facility that will enable us to open a one-day-a-week clinic. And I got to thinking about this fellowship's commitment to all sorts of disenfranchised groups. And our gender-affirming care patients they're certainly top of my list right now because of the degree to which they are being tormented at a federal, state, and perhaps even in their personal lives. But I found myself wondering, what would it look like if we as a congregation defended our values of inclusion and compassion and meeting someone where they are, if we could find a way to help get these patients seen. You already have the doctor. I'm perfectly ready and willing to continue treating these patients. But we do not have a place where these patients can be seen. We may be able to continue to receive complete backing from Planned Parenthood, but there are numerous questions that would have to be resolved. But in the meantime, I really want everyone going home today thinking, what can they do personally and what can we as a congregation do to mitigate some of this terrible hurt and these terrible blows that are hurting people who are right amongst us, right here with us. So I really appreciate you listening to me, and I'll be back soon, and we can continue this discussion in person. Thank you so much.
Good morning. So I honestly didn't know quite exactly what I was going to say, and I still don't, so we're going to just go with it in the moment. When I was invited to be part of this service, it was Jean asking if I would say something during this service about what it's like to be trans in Florida right now. And I said, yes, of course, I'd be happy to. And then in the months since then, I started paying attention to what it's like being a trans person in Florida, because that's something that I had not actually spent a lot of my time paying attention to. And I think a lot of the reasoning behind that was out of self-protection and out of fear. There's something that happens with primates, with monkey troops, with people, with humans and communities. It happens because of the way that we are, where when one member of the community is in visible, distressing pain, and all of the other monkeys in the troop can't do anything to stop that pain from happening, it spreads. The fear and the hurt and the pain, the mirror neurons start firing in those other monkeys, and they say, there's nothing we can do to fix this, and they push that other monkey out. It's not done out of cruelty or out of not seeing them as a monkey, it's out of biology. A community that cannot resolve the suffering will, over time, find that suffering intolerable, and they'll start to get angry, and they'll get defensive because they can't do anything. And the most available solution is to make the suffering invisible. Push it to the edges, remove the evidence, get rid of the monkey, sometimes kill it. Because to sit and witness suffering, unending suffering, is intolerable. I've known about this for a very long time. This is something that has been real my entire life. And so I have a habit of hiding when I'm hurt. I've been here for over 6 years, and I've watched as this community has broadcasted itself as a safe, welcoming place and community. And it tries in so many ways. I see the non-binary, gender-neutral bathroom signs go up. I see we update our covenant and we talk about things. When I first walked in, we had a non-binary minister, and this community did significant work in preparation to be a landing space for that non-binary minister. There was work done in preparation. Transforming Hearts came in and worked with people. People were practicing pronouns. But then, over time, that work stopped. And in that time since, I've kind of felt this place becoming a little bit less and less safe. And I have not done a very good job of holding to boundaries because it's hard to advocate. There's conflict. And I didn't have a ease with the right relations process. I didn't know how to say ouch and oops without people becoming very upset and defensive. If I said ouch, I would have people come to me and explain to me or lecture to me why I was wrong for saying ouch, why I was wrong for getting my toes stepped on, why they, them pronouns make no sense. And this still happens frequently. And when people come to me in email or in person and come to explain exactly why it is they're not willing to do the work that it would take to be a person I can be safe around, what do? I sit and I say, oh, yeah, that must be really hard. I see you. I see why that would be uncomfortable. And I take my own hurt and I shove it way back because that feels so much safer because I need to be seen. I'm a human being and we have these needs, pesky though they are. And I owe you a huge oops, and I'm sorry. Because here's what I've learned. When the one who is hurting doesn't say ouch and doesn't stand by that, it does protect from a lot of conflict. It protects people from discomfort. It protects people from guilt or feelings of shame. It protects them from a whole lot of things. But it also is preventing this community from feeling those feelings of guilt that maybe should be felt. and from feeling the feelings of discomfort about maybe we did something that wasn't in line with our values. But we can hold space for that feeling of guilt without transforming and becoming a bad person and becoming overwhelmed with shame and grief, and we can just feel that feeling. People can just feel their feelings and learn where there were mistakes, and then they can just move on. And I believe that that is a process that this community believes in. Transformation is at the core of things. My silence in the face of injuries was not a kindness. It was an accommodation that saved me the discomfort of conflict, but it also cost this community and myself and every trans person who has walked into this space and seen the signs and said, this is a space that will welcome me, and then was faced with the reality that it kind of is, most of the time. So with my oops, I am planning to not do that anymore. I don't want to hold other people's complicated feelings about my pronouns. Please do not come talk to me about how you feel about they, them pronouns. Please do not tell me how you feel about if non-binary is real or if it should be called something different because it doesn't make sense to you. I don't want to get emails about that. Please don't explain to me about the history of they, them pronouns and how it actually was always meant to indicate groups of people, because I don't care. That's not my problem. Your feelings matter, and you can process them in your own time or with our amazing care team, incredible group of people who can hold complexity. We have people and space here to process things, but actually process them. And know that this place is a place that so far has said we are welcoming. And if you are a person who's getting in the way of that, then maybe that's something to process too. It hurts. It really does to sit and look at somebody who's hurting, but that hurt is sacred because it transforms. It hurts to be a transgender person in Florida right now. It hurts to have lived a life where I have been told in some form or another that wherever I go, I'm not actually welcome to be as I am. And it hurts more than anything to come to a space that says and believes that it is welcoming and then is not. Because the hope that rises with that is such a hope for rest and for peace and just being able to exist. And then to have to continue to do the work of being a modified version of who I am is exhausting. It hurts so much worse for the hope. And this place doesn't need to go out and change the world. If the thought is to go create safety in a world that is unsafe, and it will probably not be safe for a long time. We're looking at way bigger stuff than anyone here has the possibility, even an inkling of hope, of changing the shape of the bigger picture. But if we're spending all of our energy and our time and our focus trying to change the bigger picture, then that's where all of the sacred potential energy of this world will get poured out into water that it cannot actually meaningfully change the balance of. But if we do the work of creating this container and together process the feelings and together maybe bring in Transforming Hearts Collective, maybe do anti-racist work, maybe do whatever we need to do to actually process and become and have a solid container, then that will change the world, not because it will happen quickly, but because when people come here and need rest, they can actually find it. There are so few spaces in this world where people can just show up and rest. And this place is so, so good already. It's so close. And if we focus on the big all the time, we're running out of energy. and I can't tell anybody here what to do. That is so far from anything I'm interested in doing. I don't care. But if we can't do that work, I ask honestly, please stop broadcasting that we are safe if we are not actually going to do the work to become safe. Because that hurts far worse. That lie that protects from the discomfort of who we are in this moment, it does make us feel like good people. But if we're not willing to do that work, let's stop telling that particular lie and be very good people at doing other work. So, oops. Ouch. I've given you boundaries. Process. I love you so much. And it hurts, and here we still are at the end of the day, and how amazing is that? And amen.
Please rise in body or spirit to joyfully sing hymn number 1053 in the Teal hymnal, How Could Anyone? And we'll sing it through twice. Elizabeth, could you extinguish the chalice for us? Or, thank you. I forgot Remy left. Please say the words on the screen. We extinguish this flame, but not the light of truth, the warmth of community, or the fire of commitment. These we carry in our hearts until we are together again. The service is over. Now your service has begun. Amen. Ashe. Blessed be.